Good evening, everyone. My paper is on punctal cautery in dry eyes, its indications and outcomes. So the punctal cautery is a technique of punctal occlusion which is aimed to increase the tear retention on the ocular surface in case of severe dry eye. In case of aqueous deficient dry eye, the tear production is less, in which the patients will require frequent lubrication. So in spite of using frequent lubricants, a patient may still be symptomatic. So for those patients, what we can do is to occlude the punctum so that there is maximum retention of the drops that we are applying. So the punctal occlusion can be performed either in the form of punctal plugs, punctal cautery, or surgical punctal occlusion. The main idea is to preserve the reserve that we have. So the aim of our study is to analyze the indications and outcomes of punctal cautery in patients with severe dry eye in a tertiary eye institute. It was a retrospective study conducted from August 2014 to April 2024. We analyzed the medical case records of the patients who had undergone punctal cautery. 62 eyes of 32 patients were included in the study. The data was collected and entered in the MS Excel sheets. We included the patient demographics, which include age, gender, indications, the etiology for the dry eye for which the punctal cautery was done, Schirmer test 1 values, best corrected visual acuity pre and post procedure, the frequency of lubricant application pre and post procedure, the symptomatology in terms whether the patient had improvement post procedure, and the ocular surface staining, which was recorded from the case records, whether the ocular surface staining was there, and the post procedure, the time taken for the ocular surface staining to clear the cornea. So this is a simple procedure. This is a procedure how it is being done. 2% of lignocaine is injected subcutaneously near the punctum to be cauterized. Sorry. 2% lignocaine is injected subcutaneously near the punctum to be cauterized, and we are applying a monopolar radiofrequency cautery is used for the procedure. Here we are using the coagulation mode in low coagulative mode. Here we are used 2, and the tip of the cautery is inserted through the punctum into the vertical part till the horizontal part of the canaliculus, and then the foot pedal of the cautery is pressed to initiate the burn, and cauterization is done till the tissue around the punctum is shranked and turned to brownish, and at the end of the procedure antibiotic ointment is applied. Moving on to the results, 91 puncta in the 62 eyes of 32 patients were studied, and it included mean age of the patients were 55.84 years, ranging from 21 to 81 years. Females outnumbered males in our study, and the follow-up was 22.61 months. These were the common indications for which punctal cautery was done in our study. Stevens-Johnson syndrome constituted 28% and rheumatoid arthritis 25%. Other indications were ocular cicatricial pemphigoid, ocular graft versus host disease, cicatricial conjunctival disease, primary Sjogren syndrome, and one case was for radiotherapy for lacrimal gland malignancy. And other indications were severe dry eye, which the diagnosis was not elucidated. So subjective improvement was noted in 91% of the patients. 29 out of 32 patients had subjective improvement. And the lubricant regarding the lubricant usage, pre-cautery, most of the patients had to use half-hourly lubricants, and post-cautery you can see that there was a shift in the use, there is a reduction in the number of the times patient is using the lubricant. So 59% of the patients had to use the lubricants half to 1 hourly, and post-cautery 38% were managing by using the lubricants 4 to 6 times. So it's a graph showing in the pre-cautery the number of the times, a mean of 15.4 times the patient was using the lubricants. It has reduced to 8.6 times post-cautery. So there is a reduction of 44% in the frequency of use of lubricant drops post-cauterization. So all the patients had Schirmer's value less than 5 mm suggestive of aqueous deficient dry eye, and the mean time period taken for the clearance of corneal staining post-cautery was 1.63 months. So recanalization was noted in 12 puncta, that is 13% had recanalization for which repeat cautery was done, and the mean time from cauterization to recanalization was 5 months, and no other complications were noted. The BCVA did not show any statistical significance. So it was one of her patient who had rheumatoid arthritis, who had ocular surface staining, who came for cataract surgery, and post procedure on the third day, the ocular surface staining had improved with the punctal cautery, and this is a picture showing the scarring of the punctum post procedure. Moving on to the discussion, these are the other studies which had studied the punctal cautery in treatment of severe dry eye. We had similar results, but none of the studies has studied the frequency of reduction in the lubricant usage. So in our study, there was 91% had symptomatic relief and 45% reduction in the frequency of lubricant use, and 87% has successful punctal closure with 13% recanalization. So punctal cautery was chosen over the punctal plugs and surgical closure in our study. And to conclude, it's a safe and effective repetitive modality in managing severe dry eye, and there's reduced dependency on artificial lubricants and relief of symptoms post-procedure. The limitation is it is a retrospective study, and we could not record the ocular surface staining score and ocular surface disease index score, which could actually quantify the symptoms and the clinical improvement. Thank you.
Anything, sir?
No, in reopening, recanalization, you have repeated the procedure.
Yes, sir.
How many times you repeated it?
One time.
One time only.
No, 13% recanalization is quite high, no?
Okay.
Okay, thank you.
Thank you.
Okay, so we've come to the end of our
Thank you to the speakers
free
and
paper
thank you
session.
to judges. Let's move on to the GV. Cine hall. Oh,